Today I'm going to talk to you all about coping with cancer. Hello all, I'm Dr. Vishwanath, consultant medical oncologist with Apollo Hospitals, Bangalore. Initially, when patients come with this diagnosis, they always ask this question, Doctor, why me? Why am I the unlucky one? So the initial discussion which we have with the patients is mainly to boost them psychologically and make them accept the diagnosis of cancer. That is the most crucial aspect. That is when patients require that emotional support and the support from the family. And I always tell patients, talk to the other patients who have got cancer and get that emotional support or slowly that feeling of acceptance. This is what is the most important and crucial aspect when cancer is diagnosed initially. So once cancer is diagnosed and the patients accept the diagnosis, the next aspect is the treatment. So whenever there is a diagnosis of cancer, patients do go through a lot of opinions, first opinion, second opinion, third opinion, because they want the right treatment to be done for them. And as most of us know, that the first treatment is the most important, and that's when the patients have long-term survival. So they want to get the best out of their initial diagnosis and the best treatment opportunities. That's when we talk about the treatment aspects holistically. And when they start treatment, it could be surgery, and then there is a lot of issues or a lot of emotional aspects come into play when, for instance, in say breast cancer, we see that is one of the commonest cancers. I can give an example of breast cancer, and patients have that fear of that body image issues. For example, say the breast is removed and then they have that distorted image feeling. That's when the patient again requires a psychological support, and we have wonderful psycho-oncologists, and we as a team are there to help them out during these times of distress. And this is just one such example, and we could just talk about every other cancer and there could be similar situations. And then once the surgery is done, then the patient may have to go through what is called as chemotherapy. Chemotherapy is mainly killing cancer cells through IV, giving the drugs through IV route, or it could also be oral chemotherapies, but generally it is IV. And again, chemotherapy leads to a lot of side effects like hair loss, which again leads to body image issues. And then it could also lead to mouth ulcers and the white counts going low. Patients have fatigue, nausea, vomiting. This is when they have requirements of significant support, both physically, family support, psychological support, and of course from the doctors and the entire healthcare professionals, the nurses. It's a team effort. And we try to counsel them regarding this, and we always tell them it's just a passing phase, and hair loss is not permanent. It's only about those few months that the patient has to go through this hair loss and other side effects, and giving them positive reinforcement during these times, and maybe asking them to go through sessions of yoga, which again, and meditation, which can also go a long way in reducing the stress which is associated with these treatment modalities. Then the patient generally radiation may be required. Radiation also leads to skin changes, and sometimes patients come up with thoughts, oh, will I get a second cancer? All these thoughts are common, and we have to counsel them and we have to talk to them in length about the fact that these second cancers and these side effects are quite rare, and to positively reinforce and making them go through this modality of treatment. So once they complete treatment, next thing is about survivorship. And these days we know that cancer patients are living longer and longer. The quality of life and survivorship are very, very important. We have to make sure that they go to their near normal life. So how do we do that? Regular yoga sessions, which can reduce stress, and exercise, aerobic exercise regularly. This can reduce the stress, and they kind of distract themselves from thinking about cancer all the time. Then we talk about diet. Diet is very important. So eating healthy, lot of vegetables rich in fiber, reduce intake of red meat. All this can be very vital when it comes to preventing recurrence and maintaining a good quality of life in these patients. And then having a good sleep. Sleep is something which is always underrated. It is very important to have at least 7 to 8 hours of good sleep. So how do we counsel patients to have a good sleep? Maintaining a sleep hygiene, not eating very late in the night, and sleeping at the same time every day, avoiding coffee, tea just before sleep. All this can make sure that they have a good sleep and 7 to 8 hours of sleep is very important, and this can reduce inflammation, and there are enough studies that it can actually prevent the recurrence of cancer. Now, talking about other methods which can actually go a long way in preventing cancer include avoiding smoking, reduce intake of alcohol, or I would say avoid alcohol intake. All this can actually make the cancer recurrence come down. All these factors help in coping with cancer pretty well.